See here. All right, we'll get started. Welcome, everyone. This is Dr. Clark from the Center for Weight Loss Success. And I won't say tonight, it'll be today on Losing Weight USA, since we're obviously at a new time. So today on Losing Weight USA, I'm going to talk a little bit about B vitamins. B vitamins are often thought of as energy vitamins, and they do help us produce energy. We'll talk a little bit more about it because it's kind of an oversimplification to say they're energy vitamins. But still, I'm getting a message that hopefully things are working. My camera's working. So hopefully you can hear me, which is probably more important than seeing me. And the slides typically are more for me. But anyway, hopefully you can see and hear me out there. I got a message that I can't, but the camera seems to be working fine. So hopefully it really is. So each webinar is going to last about 30 minutes or so. Kind of, if you have questions, type them into the chat box as we go along. We'll answer them at the end. And if you think things once we're all done, just give us a yell here at the Center for Weight Loss Success. The email is success@cfws.com. Phone number 757-873-1880. You'll probably see us when you do come into the office or around the office. You'll see us kind of with these masks on. I got my little colorful mask on just to give you a little distraction there for a minute. But yes, we're trying to keep up with the social distancing thing as well. So you'll see the chairs rearranged, and we are trying to keep the waiting room from getting too full and things along. So we'll try to keep things moving though, and hopefully helping you out as well. We'll find we are doing some. Just to digress here before I dive into the whole webinar, is that we're starting to do some more virtual type of appointments. So for people that are thinking about weight loss surgery, if they're a little concerned about coming in, we can do virtual appointments. We just have them watch the webinar ahead of time. And for those of you that are a little distance out, so to speak, from surgery, do some of those follow-up appointments as well. Obviously, if there are new problems or something we have to actually kind of, truly examine something, then obviously those have to take place in the office here. All right, well, let's get started. So we're talking about B vitamins. Let me get these slides switched over here. And there we go. All right, so hopefully you can see me fine. Okay, so the slide. So we're talking about B vitamins. And B vitamins, again, are often referred to as energy vitamins. B vitamins actually don't give you energy. What they do is they help the energy-producing equations run much more efficiently. So they're actually what are referred to as coenzymes. And enzyme systems are typically kind of what make things happen. So kind of enzymes typically are proteins. We talked about enzymes and protein, but these are coenzymes, meaning that they makes these enzymes work a lot better. And so they make the energy producing equations work much more efficiently. And it's similar to, and this may not be the greatest analogy, but often it's kind of similar to the oil in your car's engine. The energy for the car comes from gasoline, but your car is not, or the engine is not going to run unless you have oil in it. And it's got to be better oil. You're also going to have better running the engine then. So the B vitamins are kind of like the oil in the engine. They don't actually give you energy, but you can't produce the energy without having the B vitamins there. Okay, so very, very important. So as a generality, all the B vitamins are very important for energy production. They don't actually give you the energy. Now, all B vitamins are water soluble. We kind of divide vitamins into being water soluble and kind of oil soluble. And it's really, but most of the vitamins work well together, and you need, having a whole lot of one with very little of another generally doesn't work well. A good example of this is actually the vitamin D, which is not a water-soluble vitamin, it's a vitamin. But vitamin D actually works best with vitamin A and vitamin K. The three vitamins together kind of work in synergy. And many of the B vitamins are similar to that. So we need them it's not just one. So it's kind of they're often used in multiple places along the energy producing equations. And if you're deficient on one, it can give you, problems down the road with other ones, when the other ones may actually be fine. Okay. All right, but anyway, B vitamins or any vitamins, actually very, very important. And routinely, we can get our vitamins from food. Okay, the best food has no labels on it. It's fresh, it's whole, it's clean, it's green. Those are kind of the best things. The best sources for B vitamins are actually kind of the meats. The meats are the best source of B vitamins. And so one thing, and I may mention this again later, is that vegans may actually have a harder time getting all their B vitamins in, because obviously they're not having meats, but there are B vitamins in nuts and beans, and there's some small amounts in colorful vegetables, but not nearly, so the meat sources. Okay, the meat is one of the best sources for pretty much all of B vitamins. All right, so little joke here before I turn in. If you can see the slide, great. If not, I'll kind of describe it. But it's one of those things, Dr. Clark, don't quit your day job yet, because it's not that funny. But here it is: it's vitamin C talking to the physician or the psychiatrist, and the psychiatrist is telling him is talking to vitamin C. You have a fear of thiamine, riboflavin, niacin, better known as a vitamin B complex. All right. Not so funny. I agree. All right. So we're going to go through the B vitamins. Okay. We're going to go through them what I'll call in order. When I say in order, the B vitamins are typically named and numbered. So there's kind of B1 all the way up to B12. Now, if you'll know earlier, I said there's 8 B vitamins. So why the heck does it go up to B12? Which is a really good question. Because when they first started naming the B vitamins, as they went along, they realized that some of these things they had named as B vitamins or counted as B vitamins weren't actually B vitamins. And so then they dropped out. Okay. So there's 8 different B vitamins, but yes, they go from B1 to B12, and there's a few numbers that are skipped, obviously. Okay. Well, we'll go through these again. B1 is thiamine, and thiamine is extremely important because it's, just like all of these B vitamins, very important for energy production, but for brain function is probably one of the best things. It was the first B vitamin discovered, therefore it's B1. Okay. Very important in carbohydrate metabolism, thyroid function, energy production, nerve function, enzyme activation. One of the biggest, a thiamine deficiency, a classic example of thiamine deficiency is kind of as someone who is an alcoholic. Alcohol can affect your absorption of B, but most people that are alcoholics don't get enough thiamine. And that's what causes a lot of the brain problems with alcoholism. It's a thiamine deficiency. Okay, so thiamine deficiency symptoms, again, fatigue, confusion, headaches, forgetfulness, depression, insomnia. You'll notice whenever I go through pretty much all of these B vitamin deficiency, what are the symptoms? They're almost always going to have to do with nerve function, brain function, which includes things like depression and fatigue and all that. These are neurologic problems. So almost all the B vitamins will affect these things. So if you just kind of looked at, if it has neurologic problem, B vitamins are probably related to it. We'll see B1 deficiency really common in high carbohydrate diets. Again, because the best source of B vitamins often is the meat sources. So somebody that's a really high carbohydrate diet often doesn't get enough B vitamins. But also high alcohol content, I mentioned alcoholism, high coffee use, but also some hormone birth control, can actually affect your thiamine. Very rare. Okay. Normal dose of thiamine, 10 to 100 milligrams a day. And then, I meant to, and I didn't do it. I was going to show you our little B vitamin thing, the activated B vitamin. We'll talk about that at the end, though, about activated versus normal B vitamins. All right, B2. B2 is riboflavin. Riboflavin, again, they're all essential. Okay, we need to take these things in. Oh, and if I didn't mention this earlier, B vitamins, again, all water soluble, which means that we can't store them well. Meaning that if you tend to run low on B vitamins, you can wipe out your stores fairly quickly, within a few days. Some of them up to a couple weeks can be stored, but most of them water soluble. Within a few days, you can actually kind of be deficient in the, not really deficient, but actually running low on these type of things. And so it is something that kind of keep the supply coming in all the time. Whereas fat soluble vitamins, that you can store them, okay, which then also means potentially you can overstore them, but those are kind of fairly rare too. But since they're water soluble, you do have to kind of keep bringing them in on a consistent basis. Okay. Riboflavin, very important for healthy eyes and immune function and tissue healing. So this one's a little bit different, but it also needed to replenish antioxidants. Antioxidants we talked about is going to help prevent cellular damage, and which then can slow down aging and kind of cellular breakdown. You want to slow that down as much as possible. So your antioxidants are very important, which we've talked about in the past as well. All right, so deficiency symptoms, again, fairly common: depression, dry skin, light sensitivity. A little bit there, couple little different things in there. So often, again, B vitamins, I talk about neurologic, but also it can affect immune function, but also skin things. So often with really low symptom or low, fairly deficient problems, is that you may end up with skin problems as well. That's also fairly common. In relative dose, 10 to 100 milligrams. And again, if you're taking a B vitamin, very likely a B complex, it's going to have enough in there. Another little just tidbit of information about riboflavin is riboflavin is typically the culprit when people notice that, gee, I take B vitamins and my urine's really, bright yellow, bright orange, that type of thing, because the breakdown products of riboflavin that actually tend to cause that. So sometimes people mistakenly think then, gee, I'm just peeing out all these vitamins. Okay, I take this B vitamin and gee, an hour or two later, all of a sudden I'm peeing out this bright orange, or yellow urine, and then I'm just wasting my B vitamins. Like, no, you're not. Actually, it's the breakdown products of the B vitamins, the breakdown products of the riboflavins. That actually means you're utilizing them. So that doesn't mean you're wasting them. Okay? Now, since they are water soluble, yes, eventually kind of the breakdown products are going to wash out, through the urine, very common. Okay, so, but that is kind of the culprit of kind of the bright color that you may notice. All right, niacin is B3. Niacin is often used to help with as a cholesterol treatment. So it's one of the first cholesterol treatments out there. So it's a common one before you put on prescription medications. Often people will use niacin. Okay, you just have to be a little careful starting niacin because it can cause some flushing and kind of feeling kind of flushed. Okay, yeah, you literally do get this flush throughout your body. And so it's something that if you take a smaller dose and slowly work your way up, it tends to go away as your body adjusts to it. But they also make non-flushing niacin, okay? Because it's typically in the activated form. If you take it in the activated form, again, at the end, we're going to talk about activated vitamins versus unactivated vitamins. Okay? So niacin, very important, and can lower the LDL and raise your HDL. You can also lower triglycerides, which kind of all these things are good as far as kind of fat metabolism, cholesterol metabolism. It's also very important in adrenal function and for breaking down of pretty much all of our energy, like carbohydrates, protein, and fat. So it helps with just energy production, breaking down of some of our calories that's used for energy production. And again, deficiency, common sense, like confusion, depression, fatigue, weakness. And again, here's like a skin thing, mouth ulcers and headaches. So a lot of these, again, neurologic, brain type of things, and often some immune problems and skin problems. Very common. So if you have any of those, potentially B vitamins could be helpful. Okay. Typical doses, again, 50 to massive doses, 3,000 milligrams per day. And this, again, is kind of as used as a treatment. And if you use them, you may have to slowly build the dose up if you're prone to the flushing side of the whole thing. And this B vitamin B3 all by itself potentially can increase homocysteine levels. So we're going to talk a little bit. Homocysteine is a kind of an inflammatory process. So often for people that have heart disease, cholesterol problems, you may find their cardiologist or their primary care physician may occasionally check their homocysteine levels, make sure they're not getting really high. All right, B5, notice there was no B4, okay, but B5, pantothenic acid. Pantothenic, panto just means everywhere. So it's found in many things, okay, but it's also involved in many things. So often, again, metabolism of carbohydrate, protein, and fat. So we're kind of our energy production then. But it also aids with immune function, wound healing, fat mobilization, adrenal function, again, formation of vitamin D too, which we talked just a minute about, a little bit of. So deficiency symptoms, again, fatigue, they're kind of vague symptoms. Okay, so fatigue, burning sensation, depression. This is a little bit odd. There's an enlarged trunk. Muscle cramps, okay. Graying hair, hopefully I'm not deficient in pantothenic. I do take my B vitamins, so I shouldn't be, but I can blame it on something. The gray hair, I doubt it's that. All right, other things that can kind of decrease your pantothenic acid kind of absorption, utilization, really high caffeine, high estrogen levels, sleeping pills, they can affect that. Normal doses there, 50 to 250 milligrams a day. And that's when a lot of these doses will be. B6 is pyridoxine. Okay, if you take it in an activated form, it's called P5P or pyridoxal 5-phosphate. Why do I care that much about? Because B6 is one of the few, basically really the only B vitamin that potentially you can overdose on. Okay? You can't overdose on the activated form. So if you're taking it in an activated form, you can't overdose. You can take massive doses. But potentially, and it's actually a very rare, it's kind of a genetic abnormality that you could easily take too much B6. Okay? For most people, they can't. Okay, but there's a small percentage of the population that actually can. But if they were to take it in the activated form, it does not occur. Okay? Again, works with all kinds of different enzyme systems. As we get older, we need even more of this. Okay? Deficiency symptoms, again, those common things we talked about. Depression, fatigue, insomnia, mouth ulcers, numbness, weakness. Those tend to be neurologic type of things. Really high doses have been shown potentially to be helpful in autism and also in difficult, premenstrual syndrome, okay, fibrocystic disease, but also premenstrual syndrome. So if you have a lot of problems with that, potentially B6 can be helpful with that. So there is some evidence, not the greatest, but it has some evidence, but it can be treated kind of all different types of neurologic type of problems again. So PMS, again, another one, irritable bowels. So these things are kind of more of inflammatory, those type of things. So the B6 is something that's been used to treat different things, which makes it a little bit different. You just have to be a little careful with B6 because there's a very small percentage of the population that can take too much of it. Okay? If you take it in the activated form, again, P5P or pyridoxal 5-phosphate, okay? Again, normal doses, 500 milligrams. Again, you can take massive doses typically. All right, B7. B7 is biotin. Biotin, people talk about it all the time. So biotin is a B vitamin, B7. And again, often people take it to help with hair problems. And so skin and hair problems, biotin can be helpful with. It's another one, again, fairly consistent along the B vitamins. Biotin technically is something you wouldn't have to take in extra. And part of the reason is because the flora along our intestinal tract can actually make biotin. And so even if you took no biotin, if you ate a healthy diet and you had healthy flora along the intestinal tract, the flora itself can make biotin, and subsequently then you could absorb the biotin from that. So now we can actually get it from the bacteria that live along our intestinal tract, which is, again, goes back to healthy bacteria. And that goes back to the discussion on probiotics and things like that. All right, so biotin, though, can be also helpful in insulin sensitivity. Okay, so it can help for people that are really insulin resistant, potentially extra biotin can help, but it also helps with healthy skin, healthy hair, healthy nails. Okay? And so again, you can take great big doses of this as well. And that's why sometimes people take a biotin all by itself. Okay? But typically most B complex will have extra biotin in it too. All right, B9. B9 is folic acid. Folic acid, made a big, in during pregnancy. That's what is probably most important for humans. It's important all the time, but during pregnancy, because deficiency in folic acid or folate, okay, folic acid, folate, they're the same thing. Okay. Deficiencies in folate during pregnancy can lead to spinal cord abnormalities. Okay, so that was the part of the problem, or part of the thing of the March of Dimes and those kind of spinal cord abnormalities. Make sure that pregnant women take their vitamins. It's very obviously, if you're taking a prenatal vitamin, it's in there. Okay. So it's very rare that we actually see a folate deficiency. Not impossible, because if it occurs and it correlates with pregnancy, that's where the problems come in. Okay. So deficiency symptoms, okay, again, very similar to a lot of the other ones. Yes, depression. This one, though, you can also get loose bowel movements, you get sore tongue, graying hair. Again, hopefully that's not a problem there. Weakness, insomnia, impaired wound healing, numbness, tingling, some birth defects. That's the spinal defects there. Things that make it harder to utilize or harder to absorb folic acid: high alcohol, tobacco, aspirin use, birth control pills. So again, some of these things, fairly common things that are utilized out there, can potentially decrease your absorption and utilization of B vitamins. All right. Typical dose, 400 micrograms a day. So it's kind of a fairly, small numbers we're talking about. And B12. Okay, B12 is cobalamin. You'll often hear it as cyanocobalamin. Cyanocobalamin is in the inactive form versus methylcobalamin, which is the active form of it. But B12 is probably the most well-known, but it's also the reason it's most well-known is because it is probably the most important one. Vegans, again, generally won't get enough of this because it typically is meats that give us the best source of these things, especially organ meats. Absolutely essential for DNA synthesis, which is kind of making new healthy cells and genetic materials, but also protein synthesis, nerve function, red blood cell formation. So this is kind of where B vitamins can come in with anemia. Okay, kind of iron deficiency anemia is sometimes actually a B vitamin deficiency, and so this is the one where you can actually fix an anemia with extra B12. Definitely needed for carnitine metabolism. If you're not familiar with carnitine is basically an amino acid. And so, but it's an important amino acid in fat mobilization. So you'll sometimes see, if you went to the supplement store, you can actually buy carnitine. Okay, and you'll see that advertised. You may see it on the internet and things like that. And for some people, it actually can be helpful for fat mobilization. But most people have plenty of carnitine, so it's not like we have to supplement all these things here. Deficiency symptoms, again, confusion, depression, dizziness, fatigue, insomnia. If you were really low, you can be anemic, can be one of the first symptoms, which then is fatigue. But also nerve problems, kind of the peripheral nerve problems. Yeah, I get numbness in my legs or my arms or somewhere tingling, that, that can actually be a B vitamin deficiency. And so extra B vitamins is an easy treatment there. It doesn't need $1 million workup. Then it's just, okay, takes extra B vitamins. So again, those 8 different things that we just covered right there. Now I'm going to shift gears a little bit and talk about a couple different things: methionine, inositol, and choline. And if you get B vitamin injections, or if you come to the office and got B vitamin injections, you'll notice that we add MIC, which is methionine, inositol, and choline. Okay, methionine is an amino acid. Okay. And why is this important? Why could it? Why do we put it in part of the injected? As a B12. Okay, which we're going to talk a little bit more about in a minute. So methionine is an essential amino acid. It facilitates the breakdown of fat, so it helps with fat mobilization, but also helps prevent fat accumulation in your liver and in the arteries, which you don't want fat accumulating in your arteries or in your liver. Both of those are going to be problematic. And I mentioned homocysteine earlier, in that we don't want homocysteine levels real high. So methionine helps normalize homocysteine levels. Okay? Methionine, you'll sometimes see it sold as a supplement. The issue there is that if it's taken orally, it's just digested. And so subsequently then, are you really getting the methionine out of it? Because your body will then have to it gets digested, broken down, reabsorbed, then it has to be remade. So the issue with kind of, if you can get it in injectable form, it's right there. It's in a kind of a depot right there, and with the vitamins and subsequently it's just brought into the blood vessels, and subsequently you can transport it to the rest of your body without it being digested and broken down. Inositol. Inositol is one of those things that was thought to be a B vitamin. It's actually called B8. Okay, it was thought to be a B vitamin. They realized, well, it's really not a B vitamin, so it fell off, and that's where kind of when they kept making more names of B vitamins. Subsequently, this one dropped off. So they're only in 8 B vitamins, even though we have 12 that are kind of long numbers to go up to 12. Absolutely essential for digestion and transportation of fat. Then again, so okay, we're talking about fat breakdown then. So it does help reduce LDL, so the bad cholesterol, and helps with keeping the good antioxidants too. Really high caffeine can produce a deficiency. Again, these type of things are really rare, but it's sometimes used by itself to treat depression. Again, these things are kind of be neurologic type of things, depression and panic disorders, that inositol can actually be taken. In injectable form, again, you don't have to absorb it. It's kind of already in an activated form. And then choline. Choline is a very important part of the neurologic transmitters, acetylcholine. So it's very important in the making of acetylcholine. Acetylcholine is the neurologic transmitter where nerves talk to nerves. And so the message has to go from one nerve to the next nerve. And typically the transmitter is acetylcholine. So it's very important transmitter. So we need this type of thing. But it also can aid in mobilization and metabolism of fat, lowers LDL. So again, kind of fat mobilization utilization. Absolutely required for normal brain function. That's the acetylcholine type of thing. So we do add it in some of these injectable forms. I mentioned earlier activated versus inactive vitamins. So vitamins are normally given in an inactive form. Well, does it matter? The answer is maybe. Okay. When I say it's an inactive form, what tends to happen when you take your multivitamin, vitamin whatever kind, if it's an inactive form, your body you have to ingest it, has to go down the intestinal tract, then it has to be absorbed into the body, then it actually has to be activated, which means then your body has to do something to it so that it actually can be utilized. Okay, so if it's an inactive form, and then it has to be activated. And the vitamins have to be activated for you actually to utilize them. Now, part of the problem here is that many people won't actually activate their B vitamins efficiently and effectively. And therefore, an activated form is actually potentially a better form for them, which is easy to get because you can buy activated B vitamins. That's what we have here. I meant to bring in a little bottle here. So, hey, the vitamins that we have are actually the B vitamin, the B complex that we have here is actually in an activated form, which means each of the B vitamins is already activated. All you have to do then is absorb them. So it still doesn't mean you still have to absorb them from the intestinal tract. But once they're absorbed, they're ready to work. Okay, there aren't other steps that have to be done to them. And so this can actually improve the efficiency of your actual utilization of the B vitamins. Okay, so pharmacy grade vitamins are often in the active form as opposed to kind of the inactive form. That doesn't mean they're not a good brand, like the Centrums, the one-a-days. They're actually, most of those in inactive form, But if you don't activate vitamins well, they may not work as well as an activated form. Typically, activated vitamins are going to cost a little bit more. Not a whole lot more, but a little bit more, because there are more steps that have to be done when they're actually making vitamins. It makes sense, but okay. And some people do much better than with an activated B vitamin. All right, injections are kind of alluded to this. Injections means they're given, in the muscle. Okay, and it's just a different way of getting vitamins. Okay, I'm going to digress here again for a second. Okay, because they'll sometimes say, "Hey, can I put a vitamin patch on me, or the vitamin cream on me and get it?" The answer is, it might be helpful, but it may not at all. Your skin's meant to be a barrier, not really supposed to absorb a whole lot of things. So whether that actually works well, and there are some studies that look at, gee, if I take a vitamin patch, do you actually absorb them well? And a lot of them are not absorbed well. Okay. So anyway, giving an injectable form is another route. It's going to get there. It's going to get into your body. We do know that. And people often ask me, gee, will a B vitamin injection help me? My answer to that is maybe. I typically see 4 scenarios. Gee, my energy level's a lot better. Number 2 is, hey, it actually helps with weight loss. Number 3, hey, it does both. Helps with energy level and helps with weight loss. And number 4 is, well, it does nothing. Okay, that doesn't mean you're not getting some benefit from it, but gee, I don't really notice a whole lot. Why would that be? Why would you get all these different things? Well, if you do fine with oral, pills, and your body activates the B vitamins really well, and you absorb them well and you use them effectively, giving it an injectable form won't help that. It's like, no, it's probably for those people that actually don't absorb them well, activate them well, and subsequently utilize them well. Then an injectable form may be very helpful. Unfortunately, there isn't a way to test for that. It's like, well, no, let's give it a try. If it's helping you, do it. And most people, I usually tell them, if you're going to try it, do twice, because the first time you may not notice a whole lot. It's like, but if you've done it twice and do it once and then 2 weeks later do it again, is that okay? If it's not helping you, quit doing it. You're just wasting your money. Take your regular vitamins the way you always did. You'll probably do fine that way. On the other hand, though, for some people, they can literally tell when their injection is wearing off. For most people, if they're doing it long term, it's usually going to last about a month. Okay, so I know how often do I have to do it? Well, you'll probably know, but it's going to last about a month in the long term. Okay, so it can be helpful, but there certainly isn't any guarantee there, because you may activate your vitamins just fine, absorb them just fine, and by taking them in an injectable form, it may not be helpful at all. And again, the ones we use here, it does have B12, but also methionine and acetylcholine, which can potentially help with fat mobilization. All right, so in summary, as we wind all this down here, I think I went over time a little bit. B vitamins are essential, absolutely essential. They're essential for muscle function, nerve function, fat mobilization, energy production. Best vitamins really come from food, okay? But B vitamins can be very helpful. So yes, I do recommend them. I routinely take a B vitamin every day. Do I actually need it? If I check my levels, would I be deficient if I didn't take them? No, I'd probably be fine. But they do, I notice this when I don't take them, is I don't feel quite as well. And that's something people often figure out over time. And again, because they're water soluble, it's something that you can not necessarily be deficient within a few days, but you can get lower levels there where you start seeing some of these symptoms that may pop up. All right, very good. I think that I covered everything I wanted to cover there. Obviously, if you have questions, just pick up the phone. Okay, I would once all the dust settles with this COVID stuff, say walk right in the door. But an easy thing to do is send an email, send a text, pick up the phone. That you can do from anywhere. All right, very good. So kind of, again, I normally say stop by the center, get your body comp done. Well, okay, maybe not quite. once the dust settles, yes. You should be receiving the health tips and weekly recipes. Tune in each Tuesday. We're going to start, they're in the slides 6 p.m., but actually we start doing this more at 12:15. You'll get the recording though if you miss it, so don't feel like, oh, I missed something there. All right, very good. Again, keep going with your weight loss. Just kind of quick, you do take your vitamins. I encourage everybody to do that, and we'll hopefully see you in the very near future. All right. Take care, everyone. Have a good day.